Today we'll be discussing about frontal cells. Frontal cells are anterior cells that pneumatize into the frontal recess. So what is frontal recess? The frontal sinus outflow tract is in the shape of an hourglass. The superiormost part forms the infundibulum, that is just below the frontal sinus. Then the middle narrowest portion forms the frontal sinus ostium. This is the area that usually get blocked when there is a inflammation or infection of the frontal sinus. Then you have the inferiormost part is known as the frontal recess. The space of the frontal recess is dependent on the degree of pneumatization of the anterior ethmoid cells. So what are the boundaries of the frontal recess? Anteriorly, you have Agger nasi. Medially, there is middle turbinate. Laterally, there is lamina papyracea. Posteriorly, you have bulla ethmoidalis. Any cell that is pneumatizing above the Agger nasi is known as a frontal cell. So different types of classification are there. So what are the classification of the frontal cells? Kuhn's classification. In Kuhn's classification, there are 4 types. Type 1 is a single frontal cell above the Agger nasi. Type 2 is 2 or more frontal cells above the Agger nasi, but it does not extend into the frontal sinus ostium. Type 3 is a single cell above the Agger nasi that extends into the frontal sinus. Or in a modified way, the cell extends in the frontal sinus, but not more than 50% of the vertical height of the sinus. Type 4 is a isolated cell inside the frontal sinus, or a cell above the Agger nasi that extends more than 50% of the vertical height into the sinus. Another classification is also there known as the wormald classification, International Frontal Sinus Anatomy Classification. So in this, the classification is based on the location of the cell, anterior, posterior, and medial cells. So anterior cell will be anteriorly placed in the frontal recess. So the drainage of the frontal recess will be pushed posteriorly or posterolaterally. So anterior cells are Agger nasi cell, you know about it. Then you have the Supra cell. Supra cell is an anterolateral ethmoid cell that does not extend into the frontal sinus. It is above Agger nasi. Then there's a Supra frontal cell. That is an anterolateral ethmoid cell above the Agger nasi that extends into the frontal sinus. So this classification looks big, but it is easy. Anteriorly, you think about Agger nasi, Supra cell, and Supra frontal cell. The name frontal means it extends into the frontal sinus. Posteriorly, you think about the posterior boundary of the frontal recess. You have the bulla ethmoidalis. So suprabullar cell and suprabullar frontal cell. Suprabullar cell does not extend into the frontal sinus. Suprabullar frontal cell extends into the frontal sinus. So these 2 cells, and what happens is the posterior cell will push the drainage of the frontal sinus anteriorly, and one more posterior cell is there, supraorbital ethmoidal cell. The supraorbital ethmoidal cell, name as the name goes, it pneumatizes around the supraorbital area around the anterior ethmoidal artery. So 3 posterior cells. Then 1 medial cell. Medial cell pushes the drainage of the frontal sinus laterally. It is a medially pneumatized anterior ethmoidal cell and can be attached to or located on the interfrontal sinus septal. So all these frontal cells that are pneumatized anterior ethmoid cells affect the space of the frontal recess, which in turn affects the drainage of the frontal sinus.